When I first got out of the military, I worked some factory jobs, and that didn't suit me. You had to stand in one spot all day long. I couldn't handle that, so I worked on the farm, lived on the farm all my life because my dad worked on the farm. And I've been here for over 40 years, the same spot, so I enjoy it, and I'll keep going as long as I can until I get plumbed down.
When I was 21 years old, I built this house, got married, built a house, and I've had a good life. Got a good wife. I couldn't do it without her, that's for sure.
COPD is a chronic lung condition that kind of falls in two big baskets. There's emphysema, and then there's chronic bronchitis. They're kind of two parts of the same underlying problem, but basically COPD is a problem of when people inhale, like there's negative pressure to get the air into your lungs, and then when you exhale, it's more of a passive process that the muscles are contracting down and expelling the air back out. But people who have COPD, they're not as good at getting that air back out.
Well, I always knew all along that smoking wasn't good for you, but of all the things in my life I've given up, smoking was the hardest thing to do. It first started in '07. I'd had some problems breathing, so they found out I had COPD. I was stage 1 then.
We've known he had COPD for a while, but then when he went into the hospital with pneumonia, it just came on him, it seemed so sudden. After that, we were just terrified, and when he couldn't breathe very good, we were afraid he had pneumonia again, and we're going to have to go back in the hospital for another 3 or 4 weeks.
My lungs deteriorating. It was slow at first, but it's picking up now, getting a little faster all the time.
Palliative care is care that's designed to help aid in keeping the patient comfortable. That can be pain or other types of symptom management, but it's not necessarily in someone that is hospice appropriate. They need to be seen more regularly than the physician can see them, and so the palliative care program allows hospice to provide that service.
And when he got out of the hospital, it was kind of panicky because that's the first time he'd been in there bad like that. And I learned about palliative care, and they came out and talked with us and told us what they would do, and it was like having a doctor here all the time. It was a relief to know that they would check him to let us know if he had to go back in the hospital or if it was something that could be done outside. So it was a major relief.
The nurse come out there and talked to me. She explained what they stood for and what kind of care they had and everything, and how it's possible if any kind of need you got, all you have to do is call them and they'd be on Johnny on the spot.
Well, they come once a month regularly, but they've always told me that any time that you need us to call us. And one time that I really did, it was like at 11 o'clock at night, and he couldn't breathe good. His oxygen didn't seem to be doing him any good, so I didn't know what to do. He didn't want to go to the emergency room, so at 11:30 I called him. 12 o'clock they were here, and they readjusted the oxygen and told us what to do.
But I always know they're there if I need to call them if I got a problem or something, and they're real nice people. I got a lot of confidence in them.